Hey guys, today we're going to do a lateral flexion base. We're working on the mobility of our lumbar spine, and we're going to do PAILs and rails at our end range. So our intensity is the key here. We want to get up to our best effort and high intensity with our stretches and contractions. But if we've had an injury to our lumbar spine, we really want to be careful. Just ease into it, build up over time. So let's get into it. Okay, spinal segmentation on all fours, starting off in extension and then going into posterior pelvic tilt, really focusing on one segment at a time as you come up into that extension, squeezing down with your arms, looking towards your knees, initiating from the lower back into anterior pelvic tilt, flexion down through into our lumbar spine, up to our thoracic, to our neck, looking up towards the ceiling, squeezing down, and then we go into posterior pelvic tilt. Slow and controlled. This is a sign of spinal health when we can have individual control in flexion and extension. Initiate from the lower back, posterior pelvic tilt. Try and get that wave going into that thoracic spine. Good, two more. And last rep. Well done, guys, way to go. Okay, let's go into lateral flexion. Legs apart, breathe in and irradiate, and then just slowly going into lateral flexion. Try not bring any rotation into the movement. And we're going to the right and left, searching for our best possible range. Getting that movement from that lumbar spine and thoracic, and slow and controlled, and just work in that space. We certainly don't want to be going into any pinch points or sharpness. We just go to what movement we have ownership over in our pain-free range. Okay, last one. Well done. Okay, our lumbar flexion base. Now what we want to do is get a kitchen chair. We want to come forward in the chair, so we're in line with the leg of the chair at the front. So if I come from the side, we want to sitting up straight, and then we want to flex from our thoracic spine down to our lumbar spine, and then finding that stretch in lateral flexion. This is my active range, okay? My passive range is when I go beyond that. So my active range is there. In order for me to get into my passive range, I just want to hold on to that chair leg and pull down a little bit. And now I'm in my passive range. That's what we want to work in for our functional range conditioning. So let's get into that base and start our timer. Sitting up straight, laterally flexing with our thoracic spine, coming into our lumbar and getting into our passive range. We don't want to go into sharpness or any pinch points in this position. We want to go the best intensity we can, but if we've had injuries in this area, we certainly want to start off with a very light intensity and then building up over time. Let's go through our PAILs and rails cues. So our PAILs contraction is going to be contracting our spine in lateral flexion to my left, and we're going to be going that movement. We're not going to be moving because we're going to hold the leg of the chair to resist that movement. So we're doing an isometric contraction. Our rails contraction is going to be opposite to that, going deeper into the stretch. And we're going to be going this way, deeper into the stretch. We're not going to move, we're doing an isometric contraction. We should be in our passive range. So I'm going to count you in at about 30 seconds. Just trying to breathe, feel that line of tension. If you want to increase the stretch, you bring your arm up like this to increase the intensity of that stretch through that QL. Otherwise, just put it by your side and just focusing on just getting that line of tension. Okay, I'm going to count you in. Our first contraction's going to go to my left in lateral flexion. 3, 2, 1, 15-second contraction. You're going to be holding the leg of the chair, contract, build up the intensity of that contraction, switching on those QLs, abdominal muscles. 3, 2, 1, opposite contraction. We're going deeper into the stretch. Try and build that intensity up. Keep going, keep going. Pushing down into that stretch. 3, 2, 1, and relax, holding that line of tension. 45 seconds recovery stretch. This can be a little bit crampy because your nervous system hasn't experienced this range of motion before, have active control. So if that's the case, just lighten off that intensity of that muscle contraction, but that will get better over time. Okay, I'm going to count you in another 10 seconds. We're doing our PAILs contraction. We're going to my left in lateral flexion. 3, 2, 1, and contract. Holding onto the leg of the chair. Switching on all the muscles, the QLs on that left side. Abdominal muscles. 3, 2, 1, opposite contraction. We're going deeper into the stretch. Going to lateral flexion of the thoracic and lumbar spine. Keep going, keep going. 3, 2, 1, relax, holding that stretch. It's really important the intensity of that contraction is best effort if you can. Great, and 3, 2, 1, gently coming out of that stretch. A little bit of recovery there. Now we're going to our opposite side. So we're going to reset our timer. We're going to go to our left side now. We're going to feel the QL on the right stretch. Let's get into it. Laterally flex from our thoracic spine into our lumbar, feeling that lumbar QL stretch and finding our line of tension. We want to be in our passive range. That's where we do most of our injuries. We want to open up working space there and sensory awareness, And that's why we're doing our contractions in our passive range. We're also trying to help the nervous system feel it's safe in that range. And we're also trying to get strength in that area and for the nervous system to lay down mechanoreceptors so that we have that active control in that range. We've got a minute, we've got another minute to go. So just finding that line of tension, breathing into that. Our PAILs contraction is going to go into this lateral flexion active contraction, and then our rails contraction is going to go deeper into the stretch. We're not going to be moving, we're going to be holding the chair to create that resistance so that we can do an isometric contraction. So we've got 15 seconds, and I'll count you in for our PAILs contraction. PAILs contraction is going to the right in lateral flexion. Okay, 3, 2, 1, 15 seconds. Let's contract those QLs, abdominal muscles. Really switch on the muscles around the spine, focus on that. Keep going, keep going. 3, 2, 1, opposite contraction. We're going deeper into the stretch. What can we do there? Keep going, build up that intensity. 3, 2, 1, holding that stretch. "45-second stretch here. Another 15 seconds and I'm going to count you in for our PAILs and rails contraction. Okay, 3, 2, 1, and contract. Keep going, keep going. 3, 2, 1, and opposite contraction. Going deep into the stretch. We're going to lateral flexion to the left. Really push it. High intensity here. 3, 2, 1, and relax, staying in that stretch. Another 45 seconds. Okay, 5 seconds to go. 3, 2, 1, and just slowly come out of that base. And recovery, just a stretch from side to side in lateral flexion. Excellent work, guys. Okay, thoracic flexion, and we're going to do some lateral bends in this one. Yoga block between the knees, breathe in and irradiate. Lift one vertebra at a time as we come up into flexion, only lifting the thoracic spine up, and then slow and controlled. I want you to side bend as we're flexing the thoracic spine. Really push out and hold that last bit of range of motion in lateral flexion. Slow and controlled. Do it at your own pace. Nice and slow and controlled. We'll focus on that lateral bomb, side bomb. Aye. Hold 10 seconds. Great.